Good afternoon again. I'm Sue Coates and I'm the WASH advisor for the Eastern and Southern Africa region, but here to present the work that colleagues from all countries, regional officers and HQ have been working on during 2016. As Victor started with the SDGs, we also do for water and sanitation. The big messages here are that as we move into this new era, the ambition has changed and the bar is raised considerably, both for drinking water, for sanitation, and now also for hygiene. When we look at the new definitions and as we go with narratives with governments, the understanding of these and what this has in terms of implications for where governments and countries are becomes very significant. So both the baselines will drop country by country, most significantly in water supply, but simultaneously there is a requirement for us to improve both the quality and equity of how we program. So as we go into the SDG era, we still have over 1 billion people that are defecating in the open, even though we've made tremendous movements forward. And I think one of the most important things we will now be looking at is in our discourse about how we look at financing. Not just how we finance through UNICEF, but what this means for governments when we look at public financing and access to domestic resources. So let's just give you an example of what this might mean. We in Ghana, and we seem to have a slide missing, but in Ghana, the situation is that when you look at the MDG achievement, Ghana achieved its target for drinking water. When you start to apply all those criteria that appear on this slide, Ghana, the coverage drops, and it drops significantly. It drops actually from 89% to 19%. So this has absolute consequences in terms of the political ramifications, but also the programmatic ramifications when we think about what we must do to ensure that we move. So the big message is that we're shifting to safely managed, and that the differences in levels and definitions mean that we need to take this into consideration. If we move now to the work of UNICEF with your support during 2016, more than 100 million people have gained access to WASH services. That's actually in the 3 years of our existing strategic plan. But more than half of those results have been achieved in how we've responded to emergencies through water, sanitation and hygiene. So we still have this counterbalance of desperate situations for humanitarian emergency, coupled within the same countries looking at the development agenda and how we respond. We scaled up programs in response to crisis in Iraq, in Nigeria, and in the Syrian Arab Republic, but of course elsewhere in the world. At the end of last year, moving into the Horn of Africa, something you'll all be familiar with. For humanitarian programming, the latest figures show that we've impacted 30 million people with an expenditure of over $5.6 million. If we look at the different program areas, in water and environment, there are 3 main areas that we'd like to highlight. Water, focusing on water safety, and this is very important for the SDGs as water quality comes to play. Water safety planning has been implemented in 38 of the countries, and this is something that we want to see increase. We're pleased with progress in guinea worm. For the first time, Mali has reported 0 cases, but we still have to do work in both Chad, Ethiopia, and South Sudan. Sustainability is core to our programming, and we have been working very diligently on looking at sustainability tools, sustainability protocols, and so every time we get a gain, how can we ensure that that gain is sustained? And there's an example there from Nepal where they're getting involved in cross-sector and cross-component analysis for sustainability. In the area of sanitation, we've obviously continued to look at the situation with reducing open defecation. We're getting far better and smarter at ODF protocols, and linking back to that issue about sustainability, how we can ensure that even though the number of ODF communities is increasing rapidly, that those communities remain ODF. We're getting more and more involved with looking at wider society and the role wider society plays in creating an enabling environment for people who want to make changes to water and sanitation in their homes. This has led to one campaign, which has been an international campaign on toilet heroes, looking at advocacy, civil society, and media's engagement for the elimination of open defecation. Just recently, and actually this week in another building, we're looking at how to set targets for ourselves as we move forward around sanitation. So while we're expecting that governments need to have a game plan, it's so the case that UNICEF must also have one. And this is how we will make operational our ambition to achieve the 2030 targets around elimination of open defecation, but also moving households up the sanitation ladder to ensure that we're achieving basic where we can and supporting safely managed as appropriate. One area that I think is worth highlighting is that obviously UNICEF's mandate is about equity and about reaching the most disadvantaged children. And whilst we put this in our documents, we need to work harder at understanding what equity means. And here's just a view of some work from Nepal, where we're not just taking the bare numbers for those that open defecate, but trying to look to see what that means when we unpack, both by wealth quintile, by status, by ethnicity, by the different groups in society, so that we can make every dollar count in ensuring that we can target most appropriately. And this is work that we'd like to expand on and take forward into other regions. Hygiene promotion. You'll know that this is now within the SDGs, and we're pleased to say that we've already made significant headway in hygiene programming through our CATS approach, community approaches to total sanitation. But we now have 68 countries with hygiene promotion strategies at the national level, and out of those, 63 are actually involved in day-to-day programming and operational programming with national governments. We see this as critical as a foundation, but also as we move to understand how we will measure hygiene in the SDGs. For WASH in institutions, first looking at WASH in schools, our work has continued both through leveraging partners and through direct engagement in schools. But I think of highlight here is the work that we're doing on menstrual hygiene management, speaking to the needs of adolescent girls and boys, and speaking to the needs of adolescents in schools and out of schools. So 45 countries are now implementing MHM programs. And this is, again, something that we see as central, both for WASH in schools, but also out of school girls. Hygiene institutionalization through the promotion of hand washing continues. We have spent a lot of time moving up in terms of group hand washing and finding new ways to address social norms in schools so that this can be part of the dialogue on a day-to-day basis. Sadly, hand washing in schools is not the whole story, and we still have issues with operation and maintenance and institutionalizing how governments can manage their WASH in schools, facilities and services. And so you can see that the numbers are still only nudging up, and this is something that clearly needs to be addressed. Washing emergencies, just give you some of the numbers. I said that over half of our budget and effort is spent in this area. In 2016, 28.8 million people regained access to water, 7.2 million were provided with sanitation services, and over 15 million with hand washing facilities. We're also leading the WASH cluster. Victor referred to the nutrition cluster. We've been active in 72 countries this year with cluster work. An important area moving forward, but that has been really started this year, is to look at the framework for how we engage in this so-called enabling environment. So whether we're looking at WASH and nutrition programming, or whether we're looking at health facilities, WASH and health facilities, or WASH in schools, we need to be clearer about how we engage both from the perspective of the structural factors, the institutional factors, and the governance issues. Here we work closely with Sanitation and Water for All. Some of you may have been engaged in the Washington meetings recently. And we're using the same 5 building blocks, which are sector policy and strategy, institutional arrangements, budgeting and financing, planning, monitoring and review, and obviously capacity development. So aligning the work of others together so that there is a greater voice, both at the advocacy voice, but also down at the programming level. Partnerships then are critical to our work and have continued this year with both global, regional and multi-country partners numbering over 160 organisations. I think what's interesting here is when you look at the diversity of these players. So it's moving not just from civil society and the traditional relationships with NGOs and the money that we move for our programming, but engaging people who have influence and voice, ranging from faith leaders to key civil society actors to youth. So it's different from country to country, but I think there is a big opening up of the way that we're engaging with partners. If we look at the cross-cutting issues, again referred to by Diane, France and Victor, reducing stunting is something that we're very keen to see happen. It's a regional priority across the world. But we're also looking at the reduction of neonatal deaths, improving access to school and the quality of learning, and also how we can reach adolescents. So that involves the WASH and nutrition nexus, the WASH and health nexus, and increasingly the WASH and gender nexus. What we're learning is that it's not enough to geographically locate our programs, but we need to look at the structural changes that we need to make in the enabling environment. So how can we ensure that strategies and policies, recommendations from the national level to the grassroots and vice versa reflect the different needs of the different interventions so that every child receives adequate services? We've also increasingly been involved with looking at WASH and disability. This includes a mapping this year, but you can sense where this might be. I mean, often in facilities for schools, but also in health centres and the needs in communities when they're making choices about their sanitation and water needs. We also have constraints and challenges. We're not without those. So whilst we need to recognise, as I stated before, that public financing for children to leverage domestic resources is going to be incredibly important, we need to get our own house realigned to the new world. So this involves looking differently at how we're financed, how we partner, and how we leverage resources and convene. So we're increasingly looking at viable options. So we've looked at financing for new demand as demand grows. The sustainability agenda is not over. It's perhaps only just beginning. And this is a balance, I think, between sustaining the gains, but using the critical mass created by the gains to accelerate forward and really achieve the results that we want to see. Funding for emergency WASH. We need it to be more flexible, we need it to be longer term, and we need to increasingly understand the complexities and natures of how communities are living. If you take Ethiopia in the Somali region, where we're handling famine and drought at the moment, we need to think about how the interface with our development programming really works so that we can minimize the risks that communities are facing. And also we're involved in an initiative to look at the gender issues within our own organisation, within our own sector. There are very few people like me in the position I'm in, but more alarmingly, there are very few national officers that are women, and this is something that we really want to address. So that includes working in mentoring, moving the bar, and thinking about how we can work with national institutions. Just quickly, yes, we've got resource gaps, and we need to be thinking about how we're going to fill those. We're increasing, and which is good, and we think that the results that we've achieved speak for the money spent, but we still have a significant gap in our funding for the existing strategic plan period of 520 million. Like nutrition, we're looking increasingly for thematic funds to give us flexibility and to ensure that we have adequate and high-quality technical advice positioned with government as we move into the SDGs. Our future work plan, we have a global WASH strategy, which is aligned with our forthcoming strategic plan and is aligned with all the regions and their priorities. And you can see the list of areas that we will be working in. It's not that this is specifically new, it's about how we change business where we need to, both in financing, in our narrative, and how we really ensure that the equity issues are addressed. So more work on menstrual hygiene management, adolescent for girls, whilst chasing safe disposal of excreta for all. Washing institutions, you'll see that becoming increasingly important, and of course our underlying and foundational work on washing emergencies, which we cannot drop. Thank you.